At the American Academy of Allergy, Asthma, and Immunology's annual meeting in Washington, we spoke with Dr. Michael Pistoner, who is currently practicing in Leominster, Massachusetts, and will be volunteering at Children's Hospital, Boston. He has a special interest in food allergy, anaphylaxis, and the management of food allergy in schools and restaurants. He is also the father of a son with food allergies.
If I had a child that developed lip and tongue swelling after eating peanut butter and they didn't have a known diagnosis, so this was the first time, I would consider that a severe, potentially life-threatening allergic reaction, because with tongue swelling, you never know how fast the tongue could potentially swell and if the child would then develop difficulties breathing. This would be a time to call 911 immediately. If the child had a prior diagnosis of an allergy and hopefully had an EpiPen or a Twinject and an allergy action plan, then this would be, according to the allergy action plan given by the child's physician, a time to administer the epinephrine and to treat the allergic reaction. If my child had lip and tongue swelling and I called 911 and was taken by ambulance to the emergency department, there they would be evaluated by a team, nurses, physicians. They would be looking at their vital signs, they would be looking at physical exam for signs of progressing anaphylaxis, life-threatening allergic reaction. They would be assessing to see if the child needed to be treated with epinephrine, the treatment of choice for anaphylaxis. If the child was treated that way, then they would be assessing to see whether they needed additional medication and additional treatments as well. In general, we recommend at least 4 to 6 hours of observation time in the emergency department, because there is a potential for either needing more medication or having a second phase of the allergic reaction. Once they determine that the child is medically stable, then they'd probably ask questions geared towards what the likely trigger was, what the history of other allergies was, and other comorbidities, other issues that the child has, especially like asthma, that can make a difference in their outcome. Once determining that the child is doing well and doesn't need any additional medical management or any interventions, then an extremely important thing to do in the emergency department prior to sending home is education, is making sure that the trigger, if it is known, is now going to be avoided, and that the appropriate teaching about avoidance strategies and then emergency preparedness is given to the family. So prior to leaving, just as I mentioned, they should know what they need to avoid and how to do it. If it happens to be a food, then they should be taught how to read a label and potential hidden dishes where that food can be found. Emergency preparedness then is also very important to impart to the families before they're discharged home, giving them a prescription for EpiPen or Twinject, teaching them how to use it and teaching them when to use it. From the emergency department, then the child should either go back to their primary care doctor or to have an allergy evaluation. Ultimately, some sort of follow-up with a physician or an allergist should at least be put into place from the emergency department. Blood testing, looking for specific IgE to the food, and also by skin testing, also looking for IgE to the food. And IgE is an antibody that we make to food or to any protein that we're allergic to. Education on avoidance and preparedness for allergic reactions. And right now, avoidance is the best strategy. In most cases, it's strict avoidance. And what that involves is label reading, vigilance, and communication. And communication is absolutely key. All caregivers of the child need to know that that child has an allergy to the specific food, and they need to know some of the basics of how to avoid an accidental ingestion. It's important to know emergency preparedness, how to recognize an allergic reaction and know what to do in the case of it, and have the appropriate medication, self-injectable epinephrine, available at all times. So if my child had lip and tongue swelling after eating peanut butter for the first time, I would call 911, tell them that my child was having a severe allergic reaction, and ask them to have epinephrine available. And then I'd be taken by ambulance to the emergency department, where they would be treated and observed for at least 4 to 6 hours, and hopefully we would be taught how to avoid the food in the future and how to be prepared for future accidental exposures, and given a prescription for self-injectable epinephrine and sent to have further evaluation and management by my doctor or an allergist.